So they want to say that there is no lymphatic vessel is involved in this case. So it's a straightforward case. We got a cancer, and what do you need to do? We need to explain the diagnosis. We need to discuss the management and possible treatment, maybe possible treatment options. So probably this is not coming. So if we discuss the diagnosis to the patient and say the management plan, that will be all right. So guys, for the from here, as you know, this is a breaking bad news, BBN. So what are the approaches do we follow in a breaking bad news? Who can come up with this? What approach do you take in breaking bad news?
Spike technique, I guess.
First of all, spike
technique. Spike,
who can tell me what is spikes? What does spikes mean? What does spike mean? What spikes mean?
Setting.
What does settings mean? What do you do in settings?
Means you want to actually make sure that the environment, everything is comfortable for the patient.
Yeah.
We're setting up the environment to actually proceed further.
Yep. But in the examination, let's talk about the examination. What do you do in the examination? It's in theory just you just make settings pretty much. And what do you do in the examination, real examination?
Build a little bit of rapport.
Rapport. How do you do that?
Introduce yourself.
Yeah.
Ask if the patient is okay. Ask about pain at the biopsy site.
Yep.
If he has brought anybody along.
Very good. Yep. Anyone else want to add anything? Someone else?
No, I do agree. We just need to build up a report. Good.
Very good.
To
yeah. Anyone else? Anything else? I want something else. That's why I'm asking.
So empathy to the patient.
Let's later on. This come up later on.
Yeah.
Let's come up later on. Anything else?
Patient wants
ask the patient that if he's fine.
Oh yeah, definitely we'll be asking about the pain on the side. If we take any biopsy, we'll be taking the pain on the side, if the patient is good or not. That's all right. I'm asking something else.
So can we ask the patient how much he already knows about his condition?
Yeah, that comes in the maybe knowledge.
Yeah.
We can ask whether anybody else is required along with him in consultation.
We can also ask that what is thinking that what can be the diagnosis.
What can be diagnosed? That comes in maybe invitation or knowledge. Yeah. or yeah, that could be over there, or maybe perception as well. So basically in settings, normally we cannot do a lot of things, besides, ask the patients whether there's a pain or not, whether he's feeling comfortable or not, and just giving, starting with proper empathy. What you can do is you can just summarize the whole thing. This is how we just make the patient comfortable, that the case, you are just making comfortable, and just with summarizing the case, you can build a rap with the patient. So this is how I started, or I used to do that. Okay, so what is P for? We talked about S. Sorry.
P is for perception.
Perception. What does perception mean?
What the patient know about the condition.
Yeah, what the patient know about the condition. That's right. So Dr. Sabiha, can you tell me what's I mean? Sabiha Parvin, can you tell me what's I mean?
Hello.
Yes, please. Do you know that?
No.
Okay. Okay. So let's go to Dr. Farwa. Can you tell me what's I mean?
So it means invitation.
Please don't call sir. In Australia, no one calls sir to anyone. All right, just call with the name.
Okay, doctor. Yeah.
Yeah, just no doctor. Just call with the name. This is how you have to practice in Australia. So nobody calls names. Nobody calls sir, doctor, or something like that. Just call name.
Yes.
All right. So yeah, what's I mean?
It Means invitation, sir.
Invited.
That,
What's,
yeah.
yeah, yes. Go ahead, please.
Like we're supposed to ask the patient that what he would like to know about his condition.
Yep. How much he does, how much he knows, and why he has been over here. That's right. Very good. So for K, who will say for K? Gaki, could you tell me what does K mean? Dr.
K
Gaki?
means knowledge.
Knowledge, yeah. What
You-
do you ask in knowledge?
You start to disseminate little by little information about the disease.
Yep.
In
Yep.
accordance
Very good.
to whatever patient knows first, and then you try to add more.
Yes, and when you just do this, try to make sure that you're not using a lot of medical jargon, and you are just making sure that patient is understanding whatever you're talking. Okay, just not talking from one side. It's understanding the patient. All right. So what's E mean? Who can tell? Hingama, Dr. Hingama. What's E mean? All right, Dr. Mina.
I don't know, sir.
Okay, it's all right. So we go, Dr. Sam. Dr. Sutapa. Dr. Tasnuba. Okay, so E means emotion or empathy. You need to give proper empathy. You need to show proper empathy. What comes in empathy? Who can tell us? What are the portion are in empathy?
I guess we need to say, yeah, it's go ahead.
Telling the patient that we are with you, so
Yep.
you are not alone.
Yep.
We will take care of you as much as we can.
Exactly. Or the part with tissue and water, this also
Yes,
comes
yes,
with the
yes.
empathy, right?
Yes.
So this is also very, very important. And what is S for?
Strategy and summary.
And summary.
It's
Yeah,
for
summary.
summary.
So whatever you say, is summarize it and finish, close the case. So this is how we just do breaking bad news. Let's review it very quickly. What S stand for?
Setting up the interview.
Setting up, that's right. P for?
Perception.
Perception. I for?
Invitation.
Invitation.
K for? Quick, guys,
Knowledge.
faster.
Knowledge.
Knowledge sharing.
E for?
Emotions.
Empathy.
Summary.
Summary. Guys,
Alright.
we need this very, very clear, and we have to perform all this. Otherwise, it is very, very difficult to pass any this case for us, especially breaking bad news case for us. Or all the counseling cases are very, very difficult to pass, even though it looks very, very easy, but in real, it's very, very difficult to pass. That's why I'm taking a little bit longer time over here. Let's review one more time, just very, very quick. Okay, faster. S for?
Setting.
Setting an environment.
Settings. P for?
Perception.
I for?
Information.
K for?
Knowledge.
Knowledge. E for?
Empathy,
Emotions. Empathy.
Empathy.
strategy, and
Okay.
summary.
All right, very good. So who can tell me what is the very, very important part in E? Empathy.
No criticism.
Okay. No, there's a part. There's a certain part will be in the MC examination. You have to do this most of the time. What is that?
Agreeing with
Objects.
patient.
Certain objects you can see in the examination.
Tissue.
Water and tissue.
Tissue and
water.
Be
Tissue
very
and water.
careful. If you see anything in the examination hall, try to use this. If you see a paper and pen, use this. If you see water and tissue, use this. All right. So be very, very mindful with that. All right, then let's don't waste further more time. Let's clear this case. Dr. Arif, are you comfortable now? Dr. Arif, are you there? Hello?
Hello?
Yeah, are you there?
Okay.
Are you
Yes, I'm here.
comfortable now?
Yes, Dr.
Okay,
I'm
let's start this
comfortable.
case.
Thank you.
All right, let's. Okay, I'll be putting a time. It starts now. All right, start, please.
Start? Okay. Good afternoon.
Good afternoon, doctor.
My name is Arif. How may I address you, sir?
My name is John.
Okay, John. From the case note, I came to know that you had some biopsy was taken from your throat area, and it is the report is to my hand. How are you now?
I'm well, doctor.
Do you have any kind of pain on that biopsy site?
Oh, no, doctor. It's all good. Yeah.
Okay, that's pretty good. Uh, Now tell me, do you know where actually the biopsy was taken from the area?
Oh, it's on my throat, doctor. Yeah.
Do you know why it was taken?
Oh, doctor said there might be some tumor or something like that, or so. But this is taken the tissues from there. Yeah.
Did they give you any type of hints about the disease?
No, no. They said there might be something bad. So there, my GP was a bit worried
Okay.
and thought it will be better to if they can take up some tissues from there.
Okay. But did he told you anything about the result?
No, doctor. Is there anything bad or anything alarming, doctor?
I am sorry to say, John, I cannot have very encouraging result for you. Actually,
What do you mean, doctor?
actually, the report it came as papillary thyroid cancer. I mean, there is a bad growth on your. There is a gland in your throat that is called thyroid gland, and
What you say,
uh,
doctor? What?
actually, I am so sorry to tell you this thing, but I have to. It is my duty to inform you the right thing. So, John, please calm down. And do
What
you
do I
want?
have, doctor? What is that? I don't understand.
Actually, it's a cancer on your thyroid
Cancer?
gland. Yes,
Oh
John.
my gosh.
John, here
Are
is
you sure, doctor? Are you sure?
yes,
There might be something somewhere wrong. Are you sure about that?
yes, John. The report is telling like this. Your biopsy report is like this. Please, John, don't be broken down, please. Please take some tissue. Do you want to take some water?
Doctor, are you sure?
Yes, John. Do you want to continue the consultation, or we can talk it later on if you wish, John?
Okay, you can continue, doctor.
Would you want me to call any of your family members to be accompanied here?
No, all of my family members are at work.
Are you sure you want to hear everything
Oh, yes, doctor.
alone?
Yes.
Okay. I'm so sorry, John. Actually, it is a very hard condition for you to hear this situation, but you have to be strong because if you don't know what is going on, you cannot be strong. So I think I should inform you all the things, but uh, I want to tell one thing at this moment, that is a papillary thyroid carcinoma. Yes, cancer is a bad thing for everyone, but among those all kinds of cancer, especially thyroid cancer, it has the best prognosis so far. Okay.
Okay.
And you don't need to be worried because I will be always with you, as well as I am going to involve some specialist regarding this issue, and the treatment will be started as soon as possible. And I will tell from my side that you are very lucky that it is diagnosed at a very early stage, which also uh, indicates that you are getting out of this disease. Okay.
So you mean I can be getting out of this disease?
Hopefully, because we have to perform some other investigations as well to determine how long the disease has extended. But so far, I am getting that it is confined within a little space of your throat, and if it is not spread it out, and I am almost sure that it is not spread it out, because this kind of papillary thyroid cancer, this spreads in a this grows in a very slow rate. So if
Okay.
we start treatment as soon as possible, we can expect a very good outcome in case of you.
What treatment, doctor? What do you want me to do now?
Actually, at first, have you heard anything about the papillary thyroid cancer earlier?
No, doctor. What is that?
Yes, I am showing drawing a picture for you. This is your thyroid gland. It's a butterfly shaped gland. Actually, it produces some hormones which regulate all the metabolisms of your body. Okay.
Okay.
And in your case, it had turned some malignant change. I mean, some cancer has developed in this gland. It actually happened due to different reasons. Like most of the cases, it is due to for family history. I mean, if any of the family member of you have suffered this, it can you might have this, as well as if you had any past history of any sort of radiation therapy to your neck, you can also get that. And there are some genetic conditions like we call it familial polyposis. These are the risk factors for this reason. Actually, at this moment, I cannot tell what happened in case of you, but yes, as it has already have developed, and your biopsy report is telling that it's a malignancy, so we have to promptly treat it. Because it is usually spreaded through the lymphatics. So now what I am going to do, I am going to involve a multidisciplinary team composed of an ENT throat surgeon, a oncologist, a radiologist, as well as some social supports I will also arrange for you. Are you getting me, John?
Yes, doctor.
Before doing any kind of intervention, I will perform some investigations to see the disease condition. I mean, we will immediately we will perform the CT scan of your throat. We will look there as if it has invaded any nearby structure, or any it has spread it through any lymphatic channels or not. If it is just fixed within your thyroid gland, that time and the throat surgeon may perform two kinds of things in case of you. If the tumor size is very little, that time he may remove the some portion of your thyroid gland, or he may remove the whole portion. And if on CT scan any kind of spreading is shown in the nearby lymph nodes, that time he may think of your neck dissection as well. And
neck dissection?
Neck
They'll
dissection,
cut my neck, doctor?
No, they will not cut your neck. Actually, there are some lymph nodes nearby your thyroid tissue, and if this is that it is spread over that, they will remove those cancerous portions as well. Okay.
Okay.
But you don't need to be worried, because I am placing you to a very skilled hands, and they will take very good care of you. You don't need to worry about this, because they perform this kind of operation too frequently. Okay, John?
Okay. Yes.
And if your tumor size is large, that after that they might talk with some radiologist, as if they may think of giving you another therapy that is not directly radiation therapy, but they will do the we call it radioiodine ablation therapy. They will feed you some gels which containing radioactive iodines. Actually, I have to for you knowing, actually the thyroid gland and its tissues takes the iodine. So when these cancerous cells will take that radioactive iodine, it will be destroyed. Okay.
Okay.
And after that, I have already told you that it has the best prognosis among all the thyroid cancers. So after that, when treatment will be finished, I will regularly follow you up in regular intervals through ultrasonogram of your neck and CT scan as well. But
Okay.
at this moment, I should make you aware of something like that. During operation, though I have already told you that it is almost a safe operation, and this operation will be done by very skilled surgeon. But nonetheless, there are some complication in the during the operation, as it will be done under complete general anesthesia. So there are some anesthetic hazards, as well as it can be uh, excessive bleeding, as well as some nearby structures like the nerve supplies to your vocal cord, that as well as your parathyroid gland, which is situated over this gland. These things can be, there might be some damage. So these are the simply I am telling you as a possibility. Okay.
Okay.
And
Okay.
after every operation, there are some chances of infections as well. And one thing I want to tell you, that is, as your thyroid gland will be removed, so rest of the life, there will be no more production of your that thyroxine hormone, which actually regulates all the metabolism of your body. So you have to take the thyroid supplementation throughout your life. Okay,
Okay.
John.
Yes.
Do you want to know anything more?
Anything else I should know, doctor?
I actually want to tell you that don't feel yourself alone. We are always here for you, me, as well as the other members of the medical team who will be involved in your thorough treatment procedure, as well as there are some thyroid cancer support groups. I mean, those groups, there are some social worker as well as some patients, those who had thyroid cancer, they have cured. If you have conversation with them, it will, I hope, boost up your mind.
Okay.
Okay, John.
Thank you, doctor. Thank you
Thank you.
so much. All right. For the feedback, I think Dr. Arif has because Dr. Arif has been doing a few of the role plays. I believe
Dr. Limon,
that
can I step in a little bit?
yeah,
This is Dr. Sharir here.
yeah.
Okay. Yeah, before reviewing Dr. Arif, I want to review you about your good acting ability.
Very
So,
nice acting.
yeah. So I was like doing some other things. Suddenly, what happened is Limon happened something very, very nice. If you also
Thank you.
considering apart from GP some acting thing in Australia, let me know. Anyways, just making fun. Okay, thank you. Continue.
Yeah,
All right.
thank you. All right. Thank you, Dr. Sharia. So basically, Dr. Arif, what I have been seeing in you is like building up the confidence. So that's what I just want to tell you all of you guys is try to do role plays as much as possible wherever it's possible and wherever you can. Look at the progress in Dr. Arif. His confidence level is way higher than he started. So basically, this is a very good thing, Dr. Arif. Just keep it up, and I think like if you just manage the time a little bit, then everything will be perfect for you. You have all the knowledges, uh, you have good approach, and you have good empathy as well. So this is a very good thing for you. First of all, I would say you have in 7 minutes you have missed few of them, but when after 7 minutes you have completed the rest of them, especially the scanning with the CT scan, because we have been thinking of cancer. So we need to scan with the CT scan and surgery. If you do the surgery, definitely every surgery has its I mean the complications. So you added those complications, but after 7 minutes, try to compose yourself a bit more so that you can finish it in 7 minutes. Other thing I could say about the lymph node involvement. If you see in the STEAM, you'll see that they already have said ultrasonography has been done, and there is no lymph node enlargement or involvement. So they want to give a clue that you don't have to talk about that uh, about this lymph nodes or lymphatic any spread of that. So that this is why I always like to do a summary so that I have a better understanding or a better hold on the STEM that is given in MC examinations, and all the tasks I review one more time. So I think if you just do all these things together and finish in 7 minutes, that will be perfect. And guys, I'm saying it again, it is very, very hard to pass in any counseling cases. So try to do as many counseling as possible. And AMC clinical examination is putting two, at least 1 to 2 or 3 even counseling cases in the examination, and they're not putting this counseling as a pilot case. So be a bit mindful. So I'd say if you could like summarize whole thing in 2 or 3 sentences, and if you would finish it, it would have been a bit better. As we know, uh, as we discussed that Spike's S is for summarization. So I just didn't see the summarization in the last. Otherwise, it's a very good performance. So guys, before we starting talking details in this case, do you have any questions or any queries? You can come to the mic and just share with us. Or if you want to add anything in this case, anyone? Do you like to add anything, guys? Any information that's already missed? Okay, if you're silent, I'll think there's nothing. Yep, mainly he has covered most of the things. So I'm pretty happy with Dr. Arif's performance today, and the confidence building up is really good. So let's